Good day, my name is Imelda Williams. This is the video feedback on the practice bank that I've given you for the hand and fingers. Please have your preliminary image evaluation form at hand so that you can mark your responses as we discuss each of these cases. So the first case that we have is for a right hand. The indications for this case is the patient had an injury to the hand and the palm is very swollen. Okay, so if we review, now I'm just going to go straight to where the pathology is. So if we look at the head of the second metacarpal, we can see that there is a fracture. And on this oblique view, we can see there are multiple lucencies, which indicate that it's a comminuted fracture. We can also see that the fracture is going through the articular surface. So on your feedback form then, the case is abnormal. The bone is abnormal, the cartilage and joint is abnormal because it's interarticular, and you can also see there is some significant soft tissue swelling. So your overall comment for this case would be a comminuted interarticular fracture at the head of the second metacarpal with soft tissue swelling. So for case 2, so for this case, the clinical indications is the patient has punched a door and now has pain and swelling over the metacarpals. So if we look at this view, it looks like there is foreshortening of the fifth metacarpal. And you would think maybe this could be a boxer fracture when you see that. That's when we look at the oblique, and especially down here at the carpometacarpal phalangeal joint, we can see that there is dislocation of the fourth and the fifth, and this becomes more apparent on the lateral view as well. It's important with these cases to see whether there isn't the possibility of any avulsion fractures or any fractures, which does not seem apparent on these images. So it just looks like a dislocation of the fourth and fifth carpometacarpal phalangeal joints. So then on our PIE form, so again it's abnormal. The alignment is abnormal because of the dislocation. Could not pick up on any fracture, so the bone appears to be normal. And then the cartilage and joint is abnormal, and then again there's some significant soft tissue swelling. So the overall comment for this case is that there's a dislocation of the fourth and the fifth carpometacarpal phalangeal joint. If there's a high suspicion of possible fractures of the bone, then CT might be useful to exclude that. Okay, so for case 3, we have an injury to the little finger. So if we just zoom in on the little finger, we can pick up there is a lucent line in the proximal phalanx. And then on the lateral view, we can see that there is a fracture, and the fracture is above the epiphyseal line, so that makes it a Salter-Harris type 2 fracture of the fifth digit. So for this case then, again, the case is abnormal. There's a fracture of the bone. It's abnormal. So the cartilage and joint is not involved. And also we can't really pick up on any soft tissue issues. So the overall comment then is there's a right fifth digit Salter-Harris type 2 fracture at the base of the proximal phalanx. So for case 4, we have a young child who fell on the playground and now has a painful right hand. So then zooming in, we can see that there is a break in the cortex of the first metacarpal. The break is only on the one side, which makes it a green stick type of fracture. So abnormal, and the bone is abnormal. So the overall comment is that there is an undisplaced green stick fracture of the first metacarpal. So for this case, we have a patient who's had a mulcher injury to the fingers. Okay, so first looking at the middle finger, we can see that the terminal phalanx, there's a fracture and its dislocation. You can also see that there is some significant soft tissue loss at that tip. And then we can also, next to it, if you look at the index finger, there is a fracture as well of the terminal phalanx of the index finger, and that fracture looks like it's comminuted. When we're looking at the soft tissue, so for the ring finger, it appears as if there's some small foreign bodies in the ring finger, and of course also some foreign bodies in the tips of the middle finger. And this is just the oblique, and it clearly shows also the comminuted fracture there. And on the lateral view, again, demonstrating the comminuted fracture quite well, and also the soft tissue swelling. So for our case 5 then, it's an abnormal case. It doesn't involve the discs, so the alignment is affected, the bone and the soft tissue. So you've got your fracture of the distal head of the terminal phalanx of the left finger, and then also the comminuted fracture of the proximal shaft of the terminal phalanx of the index finger. And then with the middle finger, there is significant tissue loss as at the tip of the finger. And then we've also got the possible foreign bodies at the tips of the ring as well as the middle fingers. For case 6, we have a patient who had an injury to the left index finger. So if we look very carefully at the finger and also the adjacent fingers, as well as on the lateral view, we can see the alignment is normal. There's no steps in the cortex, so this is a normal case. So when it's normal, you only need to tick the general opinion that it's normal. You don't have to tick any of the other boxes, but if you want to, you can tick all of the normal boxes. And the overall comment is normal, or you could just state that there no fracture has been identified. Then for our final case, we have a patient whose hand had been caught in a conveyor belt. So it's quite evident here that there's a number of fractures of the metacarpals. So from the second to the fifth metacarpals have been fractured. These fractures are all transverse, but you can also see that there's significant displacement, and these fractures are overlapping, which will result in foreshortening of the metacarpals. You can also see, of course, with such an injury that there is significant soft tissue swelling. However, the thumb has been spared of any injury. So for the final case then, it's abnormal, the alignment is abnormal, the bone is abnormal, and the soft tissue is abnormal. And the overall comment is that there's a transverse displaced fractures of the 2nd to 5th metacarpals. You can also add that these fractures are overlapping and that they cause foreshortening of the metacarpal bones. Thank you.